In terms of the prehensile functions of the hand is very important as it is involved in the gripping and manipulation of different objects and for different tasks that we perform in our activities of daily life, and that has no doubt that it is very important in all of those terms, and all of those functions are important and they are actually carried out by the fine control of the muscles and their actions, and for that there are a lot of muscular structures involved in the prehensile and even the non-prehensile functions, as well as the gripping and manipulating functions of the hand. And when we talk about those muscles, we majorly have two different type of muscles that are actually exerting their function in terms of hand function or the wrist functions. One are actually the extrinsic muscles of the wrist and hand, and one are the intrinsic muscles of the wrist and hand. When we say or define the term extrinsic muscles of the hand, they actually denote to those muscles which are originating or arising outside the wrist or hand, but they are exerting their functions at the level of the wrist or hand. So when we talk about the extrinsic muscles acting at the wrist and hand, so those extrinsic muscles can be divided into two types: the muscles acting at the wrist joint as well as the muscles acting at the digits. So talking about the muscles acting at the wrist, we have the extensor carpi radialis longus muscle, extensor carpi radialis brevis muscle, and extensor carpi ulnaris muscle. These muscles have a common attachment site at the level of the lateral epicondyle, and when they are actually involved in any condition that is commonly known as lateral epicondylitis, which actually gives pain to the same area which is the lateral of the lateral epicondyle, which is the common attachment or the origin site of these muscles, which is also known as tennis elbow in very commonly or in numerous cases. Moreover, other extrinsic muscles which actually arise from the forearm or other regions but exert their action at the level of the digits include extensor diti minimi, extensor indicis, extensor digitorum, extensor pollicis longus, extensor pollicis brevis, and abductor pollicis longus. But in this section, we are majorly going to focus on those extrinsic muscles which exert their function at the level of the wrist, and these are all extensor muscles because they are present on the dorsal aspect or the posterior aspect, and that is why they are also known as common extensors of the wrist. This figure shows us the major bony framework at the level of the forearm, wrist, and hand, and also the attachment site for those muscles. So if we look here, we have a common extensor origin at the level of the lateral epicondyle and above at the distal humerus. And in the forearm, we can actually take a look at different muscles which are actually arising and originating into the muscles which are including the extensor muscles such as extensor carpi radialis longus, extensor carpi radialis brevis, and extensor carpi ulnaris. As the name suggests, that extensor carpi radialis longus and extensor carpi radialis brevis are actually both located on the lateral aspect because the name of the radius suggests that. However, when we talk about the extensor carpi ulnaris, even though we have discussed that they have a common origin site at the level of the lateral epicondyle, so how come the ulnaris is in the name of a muscle which is supposed to be located laterally? The reason for that is even though it originates laterally, it actually crosses towards the other side and inserts medially, and that is why it is known as extensor carpi ulnaris. As we can see in this muscle, here we have the extensor carpi radialis longus and extensor carpi radialis brevis. However, if we talk about the extensor carpi ulnaris, it is arising from the lateral aspect but moving away and going towards the medial side. Once again, here we have the extensor carpi radialis longus and the extensor carpi radialis brevis located on the extreme lateral aspect. However, if we talk about the extensor carpi ulnaris, so it is arising from the lateral aspect, but then it moves towards the medial aspect towards to insert on its attachment site on the ulnar aspect of the wrist and forearm. Now, starting off with the extensor carpi radialis longus muscle. The origin is from the supracondylar ridge of the humerus, so it is slightly above the extensor carpi radialis brevis muscle, and the insertion is at the level of the base of the second metacarpal, or you can say the base of the first finger or first finger's metacarpal. So this is actually the second digit or the index finger, and at its metacarpal or its base or its metacarpal, there is the insertion site for the extensor carpi radialis longus. The action is wrist extension and radial deviation, because as it is located laterally, it pulls the wrist joint into extension but also causes radial deviation. The nerve supply is via the radial nerve, and the nerve roots are C6, C7. The extensor carpi radialis brevis also has its attachment site from the lateral epicondyle of the humerus. However, it is slightly below the extensor carpi radialis longus, which was located slightly above on the supracondylar ridge of the humerus. The insertion is slightly medially than the extensor carpi radialis longus on the base of the third metacarpal, which is the level of the middle finger. And as it inserts on the middle finger and in the center, or you can say the third metacarpal, it is only involved in the wrist extension and does not cause ulnar or radial deviation. The nerve supply is via the radial nerve, and the nerve roots include the C6 and C7 nerve roots. The extensor carpi ulnaris is, however, slightly different in its structure, that it arises from the lateral aspect, that is the lateral epicondyle of the humerus. However, it crosses the dorsal aspect of the forearm and moves towards the medial or the ulnar side and inserts at the base of the fifth metacarpal or the metacarpal of the little finger. And thus that is why it is not only involved in the wrist extension but also causes ulnar deviation at the level of the wrist. Talking about the nerve supply of the extensor carpi ulnaris, it is via the radial nerve, and the nerve roots include C6, C7 and C8. So here we can actually take a look at the summary of the innervation of the muscles of the wrist, which are the extensor carpi radialis longus, extensor carpi radialis brevis and extensor carpi ulnaris, and the nerve supply is via the radial nerve, and the spinal segment is C6 and C7 for all three muscles. However, the extensor carpi ulnaris is also innervated by the C8 nerve root segment. As we can see here, extensor carpi ulnaris C6, C7, extensor carpi radialis brevis C6, C7, however, extensor carpi ulnaris C6, C7 and C8. So that was all about the extrinsic muscles acting at the level of the wrist, which are also known as common extensors of the wrist, which are commonly involved in a clinical condition called the lateral epicondylitis or tennis elbow. And we discussed their origin, insertion, action, and nerve supply. I hope you learned something new out of it. Thank you very much for watching sqadia. Keep on watching.